Good morning, Rhonda.
Good morning.
And I'm Dr. Noyes at Cincinnati Sports Medicine, Orthopedic Center. And you have arthritis of your knee,
I do.
and we've been treating you for 5 years now.
Mm-hmm.
And you're in your 50s,
Mm-hmm.
and you're a housewife.
Yes,
And we've been trying to avoid surgery, knee replacement.
we have been, yes.
And so far, we've been successful.
Yes, we have.
And the Synvisc really works for you, or that's the hyaluronic acid, that's the lubricant.
Mm-hmm.
And that really works for you. Can you describe?
Very well.
When you say very well, you get it yearly.
Mm-hmm.
What's
we
it?
do.
What's it like before you get it, and what's it like after you get the injection?
Before I get the injections, I have a lot of pain just with
Mhm.
standing, walking, doing everyday chores.
Mhm.
And once I get the Synvisc,
Mhm.
then the pain goes away and things start to feel a lot better.
You can be more active.
I
and,
can be more active, yes.
And healthy, and
Mm-hmm.
and take care of your heart and everything else because you're more active.
That is right.
So it's a big benefit for you.
It is a great benefit for me.
Great benefit.
Mhm.
So now you're visiting me today, and I gave you some information that you weren't too appreciative of.
Yes, you did.
And what was that information?
The information was that Anthem's no longer going to cover Synvisc.
And so we had a discussion that some medical studies show that it is not effective, and other studies show that it is effective.
Mm-hmm.
And you happen to be one of the lucky ones because it's very effective.
It's very effective for me,
And in
yes.
fact, you mentioned to me total joint replacement. I think your words were, would they rather pay for a total joint replacement than for a Synvisc?
That is correct,
I'm not
yes.
putting words in your mouth when I say that.
No, you are
So-
not. That's what I told you.
So we're trying to help our patients out, and I mentioned that because of that, as a physician and surgeon, I really disagree with that. It's my opinion, and I have many patients just like you, that we do put off surgery. They maintain an active lifestyle, and it's a great benefit. And so we feel that some insurance companies are playing doctor, and they're not letting the doctor play doctor.
I think so.
So I told you that I think it's important for patients that are benefited to let insurance companies know of that benefit. And I think that patients have to get involved more in these types of decisions. So that's really the purpose of interviewing you
Okay.
and letting other people see that they can be benefited. And we actually are having to start a special program where we're asking drug companies to still provide it to patients at a reduced cost.
Okay.
And so, I mean, we want to try to help our patients out and not have to say, we can't do it, it's not
Right.
available.
Right.
I think, from my opinion, you're going to be able to put off knee replacement surgery for a number of years, actually.
I hope so. That's the plan.
And I mentioned to you on your x-rays today that you're not quite down to bone.
Mhm.
You're wearing out your knee,
Right.
but you're not quite there yet. Is there anything that you'd like to say as we close up this discussion and patient advocacy discussion?
Well, I think I'm going to become very verbal to the insurance company
Mhm.
and let them know my thoughts on how it's been effective for me, and
Mhm.
that I think that should be something that's covered.
Yes, well, I would agree, and I wish you the best. I
Mhm.
think we have to be more advocates
Yes.
for our patients. Well,
Mhm.
okay, well, it's nice to see you today, and
Mhm,
we'll,
nice to see you.
we'll keep this treatment process
Okay.
going, one way or
All
the
right.
other.
Okay,
Okay.
thank you so much.
You bet, thank you.